Welcome to South Florida Hospital News CEO video series. During the next few months, we will be conducting interviews with hospital and healthcare leadership throughout South Florida. Today, we welcome Colonel Brodes Hartley Jr. of the Community Health Centers of South Florida, a federally qualified health center. Colonel Hartley, thank you for taking the time out of your very busy day and joining us today. Can you give us just a brief background on the health center that has been a major force within Miami?
This organization was formed in 1971, and they started operating out of two double-wide trailers at Southwest 216th Street and US Highway 1. They came about because of a need to provide services, especially for the minority population and the migrant farm workers in South Miami-Dade County who could not receive services at the local hospital. And we have grown now from those two double-wide trailers that we have 11 state-of-the-art health centers, beginning in Coconut Grove and coming south to South Miami, West Perrine, West Kendall, Goulds, Naranja, Homestead, Florida City, and we're also in Florida Keys with a health center in Marathon and Tavernier. We will soon be opening a health center in Key West. We are planning a grand opening in August of this year.
Let's shift gears a little bit. Tell us about your family.
My home originally is Jacksonville, Florida. That's where I was born and reared. My family was originally from South Carolina, and my grandfather brought the family to Jacksonville, and that's where my father grew up, and he attended the local high school there. And so my mother was from Charleston, South Carolina.
When did you move to South Florida?
I moved to South Florida in 1984. I went to school at Florida A&M University, and I was in the ROTC program there, Army ROTC. While at Florida A&M, I was president of my freshman class, my sophomore class, and I became president of the Student Government Association. And when I graduated in 1956 with the commission in the Army Medical Service Corps, I had a 2-year obligation, and I went through the basic course out at Fort Sam Houston, Texas. And from there, I was assigned to my first assignment at Fort Benning, Georgia, as a medical platoon leader with an infantry battalion. And I decided to stay into the Army after I had the opportunity to go to Germany with my unit. That first assignment in Germany was a turning point for me to make the Army a career for myself. And I came back from Germany in 1961, went to the advanced officers course. Then I went on to my first hospital assignment at Fort Ord, California. And I was a hospital treasurer at that organization. In 1966, I had the opportunity to go to the hospital administration course, which was affiliated with Baylor University. And after an academic year, I went back to Walter Reed Army Medical Center for a residency program. And I got my master's degree in 1968 from Baylor University. And then I had an opportunity to go to school again at FSU. And I spent 2 years in the graduate program at FSU. And after that assignment, I was again assigned to Fort Sam Houston, Texas, doing some research on pharmacy services in Army hospitals. In 1980, I went back to Germany as executive officer of the Nuremberg Army Hospital. And I decided to retire from there, came back in December 1982 with a retirement effective 1 January of 1983. And I went to work immediately at Florida A&M University as assistant dean in the School of Allied Health Sciences. And shortly after I got that assignment, I got a call from the chairman of the board at CHI. Make a long story short, I came down and went through an interview and was hired.
How do you look at today the challenges that have taken place over the past year with COVID? Have you changed anything that you've done, improvements that you've seen because of the COVID situation?
Well, of course, we had to adapt to the COVID situation. We could no longer let patients come in without checking and checking temperatures and checking their backgrounds to be sure that they were not carrying COVID. And of course, we were the first organization to implement drive-through testing in Miami-Dade County.
I remember that.
Also Monroe County. Once we started that, we had to implement telehealth. We were not doing telehealth before COVID. The pandemic has made a great change in the way we do business at CHI as well as other healthcare facilities.
What does your typical day look like at CHI?
We come in at 8:30 in the morning is when we start office here. And then I would check with my chief of staff to see what's on the calendar for today. And then we would work with some of my VPs in particular on whatever issues might be facing them. And we would do some planning for the day. And of course, we would have a corporate staff meeting if it's a Wednesday, second Wednesday and fourth Wednesday of each month. We have a corporate staff meeting at 2:30 in the afternoon. So I meet with all of my executive staff at that time and my corporate staff. Then of course, moving toward the end of the day, time to go home around 5 o'clock.
What, as a person, a young person going into healthcare today, what one piece of advice would you give them as they start their career and move forward through their career?
My advice to someone is to have a strong financial education and background. Finance is what drives the healthcare system in America. And they need to be well-grounded in finance. And one of the instances I want to talk about is our teaching health center.
Mm-hmm.
We were the first federally qualified health center to have a teaching health center funded by HRSA. And we are training our physicians in the specialties of family medicine and psychiatry. So when they finish their program with us, these physicians can take their boards in those specialties of family medicine and psychiatry. So that's sort of where we are with training the next generation of professionals.
Well, again, I want to thank you for your time today and thank you for your support of South Florida Hospital News and Healthcare Report. I appreciate it. And Colonel Hartley, thank you very much for your time.
Thank you so much. Appreciate you.